I really wanted to get this video out because I think it's a really important time in the COVID crisis for healthcare workers in the UK with the risk of trauma and PTSD. And in this video, I'm going to explain why. It appears that we in the UK are in between a first wave of COVID infections and deaths and a potential second. During the first wave, healthcare workers, such as yourselves, may have faced an unprecedented level of demand on your skill set, time and emotions because of the pressure the coronavirus has placed on hospitals and intensive care wards in particular. It's been apparent to me from news articles and the accounts of friends that many departments have been inundated with very ill patients requiring intensive care in potentially very different circumstances than usual. Furthermore, the strain on departments has meant that support structures, which are usually in place, may be harder to access. Team meetings may have been shortened. Colleagues may have been busy themselves, and a sense of not wanting to bother anyone may have prevailed to prevent you from interacting in a more typical way regarding your support needs. This places particular demands on our brains and bodies, as a demanding and threatening period is likely to induce a survival response. This is where the brain functions from its threat centres, known as the animal brain, and our behaviour may be more directed towards fight, flight and freeze responses. Now, this doesn't mean that you, as doctors, nurses or healthcare professionals on the front line, would run away, become aggressive or cease to function in your working roles. This would only happen in more serious situations of traumatic exhaustion or threat. Trained professionals are very capable of maintaining their procedures and routines even in highly adverse circumstances. But what you may have noticed is feeling as if you're on autopilot, in a zombie or robotic-like state, removed from your normal feelings or reactions. You may find yourself more irritable or snappy, finding yourself frustrated easily or uncharacteristically impatient. Alternatively, you might find yourself tearful, emotional, despairing, fearful or stressed approaching work circumstances. These responses can be more present outside of work as they can be in. It is this period between peaks where pressure has diminished from the first wave that post-traumatic symptoms may emerge. This is because you may have the security for the brain to come out of its survival state, and only then can you and the more evolved parts of the brain begin to process what's happened. It's at this time that memories of the experiences you faced may solidify into the trauma memories that create ongoing symptoms. In this, COVID represents some more unusual and particular threats involving trauma. A typical definition of trauma involves an event where there's a risk of death, serious injury or mutilation to oneself or others that's experienced or witnessed. Now, COVID has possessed a risk to staff unlike anything other than the most exceptional and contagious cases in clinical practice, and threatened staff in more considerable numbers, some of which will have been redeployed to intensive and emergency departments. This may have happened to you. In this regard, experiences you may have had or you may have seen in your colleagues might have directly threatened your life or health on a scale you may not have witnessed before. You may also have felt the threat of bringing your virus home to your family and loved ones. Furthermore, you may not have witnessed the loss of life to patients on a scale experienced during this pandemic. What may further exacerbate this threat are the circumstances around COVID, which lend themselves particular ways of making sense of what's happened. This becomes a trauma risk as trauma memories congregate around painful associations or senses made of those experiences. One prominent part of accounts of healthcare professionals during this period is being there, often alone, when patients are dying. These accounts state that this is usually thought of as a time for the patient and their family, and in this regard, COVID has thrown very different and intimate circumstances in the typical patient-practitioner relationship. This brings the potential for painful questions of whether the right thing was said or done, and potentially may lead to a greater sense of attachments with patients than clinicians would usually experience. Questions of the right thing being done may arise more so with the pressures of COVID than in other treatment circumstances. This has been a pandemic where you may have had to choose who receives treatment and intervention and who doesn't. And this presents a potential threat to the conception of most clinicians as wanting to provide the best for all patients. Indeed, the weight of pressure on services and your time and expertise may have threatened your sense of doing your best for your patients at all. You may have had your sense of your professional competence and confidence challenged, and this may affect your fuller sense of esteem and well-being. The pressures and lack of resources, and this is a crisis that has seen a lack of protective equipment, may lend itself to a sense of being betrayed or let down by your employers, managers, or government itself, challenging previous conceptions of the safety they would provide. This can lend itself to enduring feelings of anger, especially so where you may consider colleagues have died because of a lack of appropriate equipment. Similarly, you may have found yourself frustrated or disappointed by the attitude or behaviour of your colleagues, as they may demonstrate a variety of reactions around the threat themselves, both emotionally and clinically. This may challenge or threaten beliefs you've previously held about your peers. Indeed, this may be a time where your beliefs about other people and society as a whole may be challenged. Scenes of panic buying and carelessness and infection prevention measures, popularised through the news, may have given you a sense that your efforts are not appreciated or are in vain in comparison to the public's part in the pandemic. Indeed, this becomes a commentary on how everyone is relating to the most fundamentally threatening change in our sense of ourselves, that we may be less safe than we were before. As memories of the pandemic form around these meanings, so too there is a potential for them to form unreconciled. Should this happen, symptomatology around post-traumatic stress disorder may arrive. In these circumstances, this symptomatology may consist of reminders or intrusions regarding certain cases, or many of them, sometimes potentially very vividly, and with them being prompted by triggers either specific and identifiable or more diffuse. These intrusions may also regard threats to your own safety. Nightmares may be present, especially where you are woken by the nightmare and where the mood of such a dream is enduring throughout the day. Sleep disturbance may feature as well, quite besides from those nightmares. This is reflective of increased agitation, which may come out as feelings of being on guard, on edge, or alert. You may find yourself prone to ruminating on those cases, either the experience of them or what they have meant for you, potentially your safety or that of family members or other loved ones. You may find yourself cut off, unable to experience enjoyment, positive feelings, or unwind with all of this going on. If you do find these symptoms present, or anything else that concerns you, please do seek the advice of line managers, clinical supervisors, and occupational health. Do recognise that other colleagues will be suffering in a similar way, and how shared a process this is was one of the reasons I wanted to make this video. Such professional contacts may be able to interact with what this period has meant for you, or put you in contact with professional support networks that would offer therapeutic spaces to interact with what has happened. Other videos on this channel may offer more immediate relief, and more specific therapies are available should these symptoms endure. I really hope this has been an informative and helpful video, and I wish you every peace in negotiating the demands of this very different and particular time. To find out more about trauma, to learn more about it, do please like and subscribe Beacon Psychology Service. Thank you.